I'm Jenny Kitzinger, and with my sister, Celia Kitzinger, we've been investigating how decisions are made about patients in prolonged disorders of consciousness. Our research has improved decision-making for patients who are being treated without consideration of their own wishes and often contrary to their best interests. Our ESRC-funded research found that doctors prescribing life-sustaining treatment to these patients sometimes had not consulted with the patient's family and friends to find out whether the patient themselves would have wanted to be sustained long-term in an unconscious or virtually unconscious state. Our work was based on in-depth interviews with patients' families and with healthcare professionals, and we tracked patients through the healthcare system and legal system over time, often several years, as decisions were made about their treatment. Patients were often being sustained by default, without consideration of what was in their best interests. We found that this was partly because doctors needed to refer cases to court to withdraw clinically assisted nutrition and hydration, but not to continue it. These types of court hearings are intimidating to families and expensive for hospitals and NHS trusts. Over the last few years, we've used our research to work with healthcare and legal professionals to improve decision-making for patients and the support for families. Indeed, we developed close working relationships with the court, as well as with hospitals and NHS trusts, to support professionals to understand their own accountabilities when faced with patients in this situation. Our findings contributed to case law in the Court of Protection and changes in policy due to a Supreme Court judgment and by rewritten Court of Protection practice directions. Well, at the very point at which the Supreme Court judgment made clear that you no longer had to go to court, there was a surge of relief among the families that we were working with. One family member said, finally we can act in my husband's best interests without delay.
I remember getting the phone call from the consultant. I just remember her saying that we weren't going to court, and I just burst into tears because it was such relief, such relief. All of us had agreed that it was the best thing for Ed, that he wasn't going to, wasn't likely to improve, and if he was, then it would, wouldn't be anything to improve really his quality of life. So to hear that they'd actually put Ed's best interests first was such relief.
The findings also led to new professional guidance from both the British Medical Association and the Royal College of Physicians, endorsed by the General Medical Council.
Well, it's been crucially important, I think, in two major respects. First of all, it has made major impact on changing the law. It's also impacted on the guidelines of how we implement those decisions. It is a very difficult area to work in, an area that many clinicians feel inadequately prepared for, and I think the Kitzingers have done an enormous amount of work to help us prepare for those difficult conversations.
When we first began, our social science research methods were a little unfamiliar to the medical and legal professionals, but it's through explaining the process of that research and developing relationships that we've been able to work with them to change medical legal practice and change policy to improve decision making for patients and support for their families.